Welcome to UMCC Medical Consultants Connectors, where we're dedicated to providing you with the latest and most important information about your family's health and well-being. Today, we're tackling a serious and often misunderstood topic: birth asphyxia, a condition that can have lasting effects if not recognized and treated promptly. Birth asphyxia happens when a baby doesn't receive enough oxygen before, during, or just after birth. This can occur for a variety of reasons, such as complications during labor, issues with the placenta, or problems with the baby's airway. When oxygen is limited, it can quickly harm the brain and other vital organs. That's why early recognition and immediate intervention are absolutely crucial to minimize long-term effects and give the baby the best possible start in life. While it's a frightening thought for any parent, understanding the basics of birth asphyxia empowers you to act quickly, ask the right questions, and advocate for your child's care. Thanks to remarkable advances in neonatal care and technology, outcomes for babies affected by birth asphyxia have improved dramatically over the years, offering hope and reassurance to families. In this video, we'll cover the key signs to watch for, how birth asphyxia is diagnosed, available treatments, and important prevention strategies, so you can feel informed and prepared. Let's dive in together and learn what every parent, caregiver, and family member should know about birth asphyxia, so you can confidently support your newborn's health from the very beginning. Early recognition of birth asphyxia is absolutely crucial and can truly save lives. As a parent or caregiver, knowing what to look for in your newborn can make a significant difference in their health outcomes. Being observant and proactive is key, especially in those first precious hours and days after birth. Pay close attention to your baby's skin color. Watch for bluish or pale skin, especially on the lips, tongue, and nail beds. This is called cyanosis, and it can be a sign that your baby isn't getting enough oxygen. Even subtle changes in color should not be ignored. Listen for your baby's cry. A weak or absent cry, slow or irregular breathing, or gasping for air are all red flags that something may be wrong. If your newborn is struggling to breathe or seems to be working hard just to get air, seek help immediately. Notice your baby's muscle tone and movements. Floppy muscle tone, poor or absent reflexes, and difficulty feeding or latching onto the breast are also important warning signs that should prompt concern. If your newborn seems unusually sleepy, lethargic, unresponsive, or even unconscious, this is a medical emergency. Babies should respond to touch and sound, so any lack of response is serious. Watch for any abnormal movements, such as seizures. These may look like jerking movements, twitching, or even staring spells where your baby seems to zone out. Seizures can be subtle, so trust your instincts if something feels off. Monitor your baby's diaper output. Low urine output or fewer wet diapers than expected may signal organ distress or dehydration, both of which require prompt evaluation. During labor, the presence of meconium, your baby's first stool, in the amniotic fluid is another warning sign. Meconium staining can indicate that your baby was stressed before or during delivery. If you notice any of these signs or anything else that worries you, don't hesitate to alert your medical team right away. Your concerns are valid and could be life-saving. Remember, quick action and early intervention can make all the difference in protecting your newborn's health and future. When birth asphyxia is suspected, doctors act fast. The APGAR score, checked at 1 and 5 minutes after birth, assesses heart rate, breathing, muscle tone, reflexes, and skin color. Low scores, especially below 3, are concerning. Blood tests, especially umbilical cord pH, reveal if the baby lacked oxygen. Imaging like cranial ultrasound or MRI checks for brain injury. And EEG monitors for abnormal brain activity or seizures. These tests together confirm the diagnosis and guide treatment. Early, accurate assessment is key to the best outcome. Immediate treatment focuses on restoring oxygen and supporting vital functions. Resuscitation may involve oxygen masks, ventilation, or breathing tubes. Cooling therapy, lowering the baby's body temperature, can reduce brain injury if started within 6 hours. Babies are closely monitored in the NICU for blood pressure, sugar, and organ function. Seizures are treated with medication. Nutrition is provided intravenously or via feeding tube if needed. After the crisis, a team of specialists supports the child's development. Ongoing care helps families navigate challenges and maximize recovery. Prevention starts with good prenatal care, making sure you attend all scheduled appointments and follow your doctor's advice closely. Early and consistent care can help identify and address potential issues before they become serious. Regular checkups are vital for monitoring your health and your baby's development, as well as managing any maternal health conditions like high blood pressure or diabetes that could affect your pregnancy. During labor, continuous fetal heart rate monitoring helps detect signs of distress early, allowing the medical team to respond quickly if your baby needs extra support. Quick interventions, such as changing the mother's position or providing oxygen, can make a significant difference in your baby's well-being during delivery. In some cases, an emergency delivery may be necessary to prevent complications like asphyxia, ensuring your baby gets the best possible start in life. Delivery teams trained in neonatal resuscitation are essential. They're prepared to act immediately if your newborn needs help breathing or requires urgent care right after birth. That's why it's important to choose a well-equipped facility for your delivery, with access to advanced technology and skilled professionals. As a parent, educate yourself about the signs of labor and what to expect during childbirth. Attending prenatal classes can help you feel more confident and prepared. Communicate openly with your healthcare provider about any concerns. Maintain a healthy lifestyle. Eat a balanced diet, avoid smoking and alcohol, and include regular, gentle exercise to support your baby's growth. Working closely with your medical team creates the safest environment for your baby, giving you peace of mind throughout your pregnancy and delivery. Thanks for joining us at UMCC Medical Consultants Connectors. We're here to support you every step of the way. Stay informed, stay healthy, and see you next time. Wishing you and your baby a safe and joyful journey ahead.